All right, Dr. Life, we're going to hit this topic of premature ejaculation. And I know it's a really big issue for men, and it's a very difficult one to sometimes overcome. Will you talk about how you address and help patients with premature ejaculation?
Well, premature ejaculation is a problem. And so I really promote for good sexual health and erectile performance. I encourage men to start learning how to do Kegel exercises. This is really familiar with women. They're taught by their gynecologist and obstetricians to do Kegels. Well, it works really well for men too. And so I teach them how to contract their pubococcygeal muscles. Then I talk to them about the different kinds of Kegels, the slow Kegels, the fast Kegels, the big move Kegels, and then the fluttering Kegels. I talk about these in my book. This is an exercise.
Through that, that Kegel, that men's Kegel exercises. Okay, teach me how to do it if I was a guy.
All right, so I guess one of the best ways to know what muscles to contract would be to, when a guy's urinating, to stop the stream and start the stream. Just stop it. In order to stop it, you need to contract your pubococcygeal muscles. You need to do a Kegel exercise. And to start it up, you relax those muscles. And that's one way to really know what muscles you need to work on. Another way is to walk into the Pacific Ocean about this time of year with your bathing suit on and walk in and get deeper and deeper, and then all of a sudden you'll realize what your Kegel muscles are doing.
Okay, I'm having a good visual there. Thank you.
And Kegel exercises, you can exercise when no one knows it. You can be sitting in a meeting.
I don't know if you could tell, but I was doing mine.
Rip off a bunch of Kegels. You can do, and at first it's really hard to do more than 2 or 3 reps. But then as you get good at it, you can do repeats. You can do 10, 12, 15 contractions. And you can just be sitting there pretending you're enjoying this meeting, and you can rip off a whole series of Kegels. You can be sitting at a traffic light and do the same. It's an exercise that you can really work on without anyone knowing it. And so I encourage my patients to learn how to do that, and then this not only helps with premature ejaculations, it helps with everything. It helps with orgasm. A guy's orgasm is much more powerful if he has well-developed pubococcygeal muscles. And so it's a win-win for women and men to really know how to work those muscles and build those muscles up.
Okay, so what else can help with premature ejaculation? Definitely the Kegel exercises, optimizing their testosterone, not too high, not too low as well, correct?
That's correct. And then working with their partner. I mean, it's a team effort, and same with impotence. I mean, if a guy is unable to get an erection, many times it's just because he's nervous or he's got some psychological issues. So if he works with his partner and they work together on it, it really helps. Helps correct premature ejaculation and helps promote an orgasm and a good erect penis. And then if all that fails, a guy needs to go to the urologist that deals with this. And so he should make an appointment, and he should ask prior to the appointment if this particular urologist deals with this and knows how to treat this.
That's a good point, because they don't all know how to address this issue, and it's important. And again, from the sexual health side, using constrictors around the penis, at the base of the penis, that definitely helps to maintain the blood flow. Okay, I just have a curiosity question, Jeff. How old is the oldest person that's come in to see you, had erectile issues, and then you were able to help them reverse that and have spontaneous erections again?
I have an 89-year-old patient that is sexually active.
I'm glad to hear it.
Sexually active. I have several in their early 80s, and then a whole bunch in their 70s, 60s, 50s, and 40s. ED is a big problem that guys don't like to talk about. They don't want to admit it.
That's so true.
But it's, and medications can be a cause of it. Psychosocial issues, political situations can suck the energy right out of you, as we all know. And then you got this COVID virus going on that really has crippled everyone's ability to move around. So all these things play into it. And I think talking about this with your significant other and having open conversations with that person really helps.
Well, that's going to... I agree. And we actually have a special with you in the Girlfriend Doctor Club, and we're going to talk about how to bring up this subject in a very loving way with our partner, because there's no area, male or female, that is more vulnerable than our sexual health and our sexual intimacy and pleasure. I mean, this is such a vulnerable area for couples. So I want to bring you inside the Girlfriend Doctor Club for a special exclusive on how we talk about this. So I want to thank you. We've got some great tips in our earlier episode on erectile dysfunction, and now on premature ejaculation. And the fact that we are talking about this, I mean, this is such good stuff. This is so important. I thank you for the work you do, and I look forward to seeing you inside the Girlfriend Doctor Club. And for our audience, Dr. Jeffry Life, in practice and MD, been in clinical medicine for 50 years. Check out his information. He, again, still sees patients at drlife.com, and you got to watch his videos, because I mean, they are just incredible, and you see what he's doing. And we sat on a scientific board together, and one time I was like, Jeff, can I just touch your abs? Are they photoshopped? And he's like, yeah, go ahead, and touched your abs. I'm like, oh my God, just incredible abs. So I love telling that story. Anyway, all right. Thank you all for being here on the Girlfriend Doctor show, and I look forward to seeing you next time. More to come. Be sure to join us in the Girlfriend Doctor Clubhouse, where we get this uncensored content with these amazing experts. All right. See you on the inside.